South Africa passed the grim milestone of 1 million cumulative coronavirus cases, this with a more contagious variant recorded. Experts fear that following the movement of more people returning from the festive period, we could see a dramatic spike in cases, causing an even worse situation for the already buckling healthcare system. Let's discuss this. We are joined by Professor Tulio De Oliveira. He, of course, is the director of KRISP at the UKZN. Great to have you again, Prof. What's your reaction to last night and the announcement from the President?
So my reaction, it is that the President did the right thing. Yeah, we unfortunately needed to get more restrictions, both in movement, yeah, but also on contact between people. For example, he banned all kind of indoors and outdoors events. Yeah. Also, we have also to try to decrease the accidents that are caused by alcohol. So in general, it was a very tough decision to the government because we are in the middle of the festive season, and we also have a completely overwhelmed healthcare system. Yeah. Of course, that the numbers grow very fast, and we are only seeing the tip of the iceberg, and we are not sure if the decision was late or not, but in general, I think that was the right decision.
A lot of people questioning this decision, Prof, in terms of, especially when it comes to outdoor spaces, and even in areas where there are a lot of holiday makers, and now that we've closed beaches and parks and all those places where people can actually go outside, they now are flocking into shopping centres and flocking into areas that are more enclosed, not well ventilated, and this could fuel the spread. So a lot of people are confused at this time. Do you think some of these restrictions are perhaps a little bit too harsh and not thought through?
So what we found is in this pandemic, it is very difficult, if it's not impossible, to get always the right decisions. Yeah, but what we also find is that the failure of acting quite quickly and strongly end up having a high number of excess deaths. Yeah. So my main suggestion for the public, it is not try to analyze every single decision and see if that's right or wrong, but really take this next 15, 20 days, as our president suggested, as a time of fitness. Try to reflect and to try to really stop going around and spend more time, quiet time with the family, because we all had a very hard year, yeah. And the list that we need, yeah, it is our hospitals getting close to be completely full, and to end up, instead of being a festive season, a season of funerals.
The one thing that some are also saying is they feel that perhaps this was a little bit too late, that we've seen these numbers go skyrocketing over the festive season, particularly over Christmas, and where people were going away, and as soon as the holidays started, and the President alluded to it as well, year-end parties, big massive gatherings. Could or should this have been done a bit earlier?
Again, it's a difficult question, because we are trying to balance the health system and the livelihoods and the economy. Yeah. One thing that we try to do as scientists, as the government, as the media, is really ask to people to slow down during this festive season, yeah, which seems sometimes to have been gone to deaf ears, yeah, and because that, I think that the restrictions end up being necessary.
So if we work with all of the data over the Christmas period and New Year, what is the projected trajectory of coronavirus cases? Where are we heading now?
So again, that's something, at least at KRISP, we normally don't do projections. We work with data in real time. So I can explain a little bit in simple terms. Yeah, what we are seeing, what we saw like 50,000 infections during the last week, or more than that, some days going up to 15,000. It's a big underestimate, and that's because we can clearly see that if we follow what we call the positivity rate of testing, which grow from less than 10% to more than 30%, what it means that we are not testing enough, and that we are not finding, especially the asymptomatic people, which continue the transmission chains. Yeah. So what I imagine is that the size of our pandemic in South Africa is manifold higher than the numbers say, just because this balancing between number of testing, positivity rate, and number and positive. But the really important data to look at the moment, it is the hospitalizations. And you have heard, like, for example, Richard Friedland, the CEO of the Netcare, come to the media and saying that his hospitals are getting very overwhelmed. You have heard from the Med Clinic also canceling non-necessary surgeries. So I think that's the very important data to follow now will be the hospitalizations, number of beds available, ICUs, and of course the very sad one with that is the excess mortality.
Yeah, you know, there has been, and there's a big question mark around this, and I'm just wondering if through studies and through the time since you've announced this new variant, have we seen that this could possibly be more deadly, this particular variant? Is there evidence to suggest this?
So again, we are working during the festive season, but very thoroughly and calmly looking at the data. Yeah. At the moment, it is very clear that this is a more transmissible variant. Yeah. And now we are trying to answer some of the big clinical questions, such as, is that more virulent? Is that more pathogenic? Our current assumption is that not. However, with the sheer number of people infected, you end up with a completely overwhelmed healthcare system. So at the moment, we have made a big consortium of scientists in the country, or with like close to 30 organizations. We are also working very close with the Netcare to try to understand some of these important questions, such as, what is the difference on clinical symptoms? Yeah, can this variant cause reinfection? And of course, can people that have been, can the immune system clear this as the other ones?
Our connection's a little bit, we're losing you here and there, but let me just move on to the next question. Hopefully it'll rectify itself. We heard the president even say last night during his address that this is, it appears to be a lot more contagious, and hence the numbers that we're seeing coming through. I mean, you know, just below 15,000 over the last couple of days, every day. And this is something that we worry about. Obviously, over a million cases is what we've seen here in South Africa. But some people still look to the active cases and say there have been so many recoveries. Why are we only focusing in on the fact that, you know, there's these new infections, which in the greater scheme of things is not that large? So perhaps you can give us an understanding as to why we're being alarmist, or why people are asking we're being alarmist for not a massive amount of people when, you know, you compare it to the population.
So the first answer, it is that looking at recoveries during the whole year, it is the wrong thing to do. Why that? If we're going to look at recovery and active case, we should look only when start the second surge of the virus or the second wave. And if you look at the data in that angle, so we have very little recoveries. Yeah, we have a very large number of active cases. Yeah, and active cases. Why we worry about active cases? Because these are the ones that tend to cause more secondary infections. Yeah, Normally, this virus, by the biology of the virus, he has what you call a secondary infection rate or reproductive number between 2 or 3. This means that each active person, if no intervention is done, will infect 2 or 3 people. But this time of the year, you have the super spreading events. And you may remember quite well the rage that happened in Balito, that over 1,000 or thousands of people got infected in one event. So one have to be careful at look at the recoveries. One have to look more at current active cases and really try to stop super spreading events.
Yeah, I like what you're saying, because I must say that the way of reporting these stats makes it very confusing, and also, it almost downplays it. So it could be a recommendation as well to perhaps, put in from the second wave the numbers, because when we're looking at a bigger picture, it almost brings it down a lot, because you look at it and think, well, it's really not that much. However, if we look at how long we've been going through the second wave for, that makes it a lot more pertinent, and perhaps people can actually understand it a bit more, as opposed to the way we are reporting right now. But this is a global standard, is it not correct?
So for example, yesterday, or the day before, they find 2 individuals infected with our variant in Switzerland, and we had an urgent call with some of the top scientists from Switzerland to try to understand this variant. And when we describe our positivity rate at 30%, they almost fall from the chair. They couldn't believe. At the moment, for example, in the UK and in Switzerland, the positivity rate is at 1%.
Wow.
What it means, why I keep bringing these statistics, it means that the size of our epidemic is much bigger than the number are looking at. And the World Health Organization, it raised the alarm when the positivity rate passed 5%. That's when we expect to be a kind of disseminated pandemic in a country, and we are at 32% at the moment.
And that is alarm enough. 32% positivity rate is a big worry. And I know I'm reading some findings from UKZN that your team is working on, saying that this variant, and I know you've spoken to it, could be between 40 and 70% more infectious, and that's something we need to know. The UK has cut all flights to and from South Africa. We've spoken about it. You mentioned Switzerland. Now they have found something in there as well, some of our cases in South Africa. This is something that is now spreading globally, and it's becoming a concern to a lot of countries to put a bit of a big red mark on South Africa.
So first, it has been shown during this pandemic that curbing travel, international travel, doesn't have much effect. And you want to remember a famous president, which I'm not going to mention the name, boasting about curbing traveling from China and end up with the biggest pandemic in the world. So that's the first thing. The second, it is that you have 2 main variants that are independently, and they seem to be more transmissible. One is the one that emerged in Southeast London, and the other one, the one that emerged around Nelson Mandela Bay in South Africa. So the one which emerged in Southeast London, now it has been found in over 20 countries. The South African one have been found in 4 countries so far. So at the moment, we think that both of the variants transmit much more than the previous variants that were in the country. Of course, that London, by being much more connected internationally, the variants will be found more around the world in a quicker pace. And the important thing here that's no competition to the bottom. What we have to do is not to try to identify which one is the most pathogenic or most transmissible. What we have to do as not only a country, but a continent and a global effort, is to curb the transmission of these new variants, because what our results and the British show that they are much more transmissible, we're going to be for a very bumpy 2021.
Yeah. Prof, I want to steal a few minutes talking about the vaccine now. And obviously, I think I have asked you previously about whether or not this new variant will still work with the vaccine that has been developed, and if it is possible that it can be effective. But we heard last night from the President that we are now only going to be seeing this vaccine in the second quarter of next year, where we'd always been under the impression that we'd at least start rolling out something in the first quarter of this year. Is this worrying you because of the spread, because of what we're seeing in terms of how this particular strain is very, very infectious? Now with this, the vaccine being pushed out, is it worrying you?
So the first thing is that this big surge and second wave in the summer of South Africa, it caught us really by surprise. Yeah, one of the reasons why they have prioritized the vaccine to the northern countries, is because they were in the middle of the winter, and normally respiratory virus, it's more known to transmit better during winter because people is in closed space, and also they already have an overwhelming healthcare system. People tend to be more sick in the winter. Of course, that this may change a little bit the way, by having this big second wave in South Africa. And I wouldn't be surprised if both South Africa, but also the World Health Organization, try to act quite quick to make the vaccine available quicker to South Africa.
So this would be something I imagine that you'd be hoping for as well, because there is concern among South Africans, and I think that there was a very telling viewer that wrote in and said where other countries are already talking about vaccine trials and people are lining up for it, we are still worrying about PPE, and that hospitals have not got adequate supply or good quality PPE and hospital beds. And, this is not a conversation we should be having in a second wave already, where we should be prepared for this. Do you think we are prepared enough for this second wave?
I honestly think that almost no country in the world were prepared enough for the second wave. Yeah. And of course that in South Africa it's a little bit more problematic to come the second wave during the time of extreme mobility and also social interactions, which in addition to have what we believe a more transmissible variant, it also have a bigger susceptible population because people is mixing much often. So I think that at the moment our main focus should be decrease transmissions and get get more beds and oxygens and healthcare workers protected at the hospitals. In the same time, will be very good the vaccine arrive in South Africa as early as possible. The only main problem is that this is a global pandemic, and we're going to be competing for everything from diagnostics, from PPE, from vaccines with some of the richest countries in the world.
Right, Professor, thank you very, very much, as always, for your time. Professor Tulio De Oliveira, a virologist who is he is a director of KRISP at UKZN, certainly spiking cases of coronavirus, now in level 3 lockdown, and that is where we end the broadcast on SABC 2. We say thank you so much.